Hello everyone, this is Mayuri and today I am going to discussing with you a topic of the what is the minimum criteria for individual case reporting. Then we have to know about the what is the minimum criteria about the individual case reporting. In pharmacovigilance, there is the minimum criteria for the individual case reporting. That is the we can define it by internationally guideline by the such as ICH guideline, then also WHO guidelines to ensure its consistency and also meaningful reporting of the adverse drug reaction. And for the individual case safety report to be considered valid criteria, it must be contain at least following for that we can say there are four criteria. That is the firstly identifiable reporter means there is the information about the patient like for example healthcare professional or patient or any their reported information. Also minimum requirement like their qualification, then some form contains like details, for example initial their address, then also contact number of the patient, also their email. These are the some information about the patient in the identifiable reporter. Then identifiable patient in the there are the information allowed the patient to the uh, um, for example initial their initiality, also their genders, then their age, then also their date of birth and other unique identifiers. Then also there are a full identifiable is not required for the for example means not required full identify for the patient, but enough to ensure that the case is the distinct to distinguish the case, important to enough criteria is most important. Then a suspectable drug or medical products. So the name of the drug, then their batch number, then their manufacturing date, expiry date, then also their precautions, then included some brand name, generic name, and classes of drug. This is most important in the suspectable drug or medicinal products. Then fourth criteria is the at least one of the adverse reaction or at least only one of the adverse event which have in the we should have in the patient, like for example the description of the suspectable adverse reaction of the event experienced by the patient, and also must it is the most included by the symptoms like diagnosis, then also clinical clinical significance, clinical signs. These are the important criteria for important criteria for the valid individual case reporting. Then there are some additional but it not mandatory additional information like doses, then route of administration, then duration of drug administration, then starting and end date of the reaction, then relevant medication history, then concomitant medication means there have any therapeutic effect, means there is the no any side effect of that drug, means these are supplementary drugs. Then these are the four valid criteria for the individual case reporting. We know that in pharmacovigilance there is the most important these four criteria. Pharmacovigilance means it is the process of the detection, assessment, and understanding and the prevention of the any adverse drug reaction and any drug related problem. Um, this is the pharmacovigilance. And in this there are these four valid criteria for the reporting of this individual case safety reporting. Thank you.